Technology that came out of the space program is being used by a local psychiatrist to help children and adults who have learning or behavior problems. 9 News consumer reporter Mark Kobrick says for many kids it means the right medication or no medication at all.
As many as 1 out of 10 children struggles with learning or behavior disorders. The problem is, it's hard to treat the problem without knowing what the problem is. Until now.
35 to 40% of the people coming to our clinic who already have been diagnosed as ADD or ADHD turn out to have another reason for their attentional symptoms.
The first step to accurate diagnosis, mapping the patient's brain. This teenager is demonstrating how the information comes together. Wearing a cap with leads, brainwaves become digital pictures that can be broken down and analyzed. The red areas indicate what portion of the brain isn't firing normally.
And this is all done with technology in the computer now.
Before the technology, making a diagnosis was largely a guessing game.
Yeah, sometimes I refer to it as throwing it against the wall to see what sticks.
Getting the right medications for the right result was often a trial and error process. And if patients with certain disorders were misdiagnosed,
those people get agitated, aggressive, angry, and some of those turn out to be school shooters because if given the wrong medicine, you can send them into a very deep, dark, evil place.
Once a correct diagnosis is made and it's determined what part of the brain isn't firing correctly, patients move to this step.
And try to focus as much as possible.
Repatterning the brain, playing what appears to be a simple video game connected to their brain.
Plugs into a PlayStation or Xbox and their brain controls it.
His acceleration is controlled by rewarding the positive brainwave.
Brain impulses actually power the car forward.
That car isn't going to move until you fire your brain correctly. If it's ADD, if you're firing like this, that car's not going to move. You better speed your brain up.
You're essentially teaching the brain how to fire normally.
When that brain locks in and it figures out what it had to do to perform that task, that is a neuron changing its set point for that task.
You can stop.
Dr. Hoffman says in terms of the advances for treatment,
I feel like I used to be in a cave with a match instead of now in a cave with floodlights.
And most importantly, the possibility of successful treatment for millions of kids. On the Consumer Beat, Mark Kobrick, 9 News.
Dr. Hoffman says the next step is machines for home use so patients don't have to come to his office for brain retraining therapy.